Dear esteemed veterinarians, a very warm welcome to today's session on avian anatomy and avian nutrition by Dr. Rani Maria. I'm Dr. Vishal Sharma, a proud veterinarian and managing director of Ori Hill Life Sciences. As a practicing vet myself, managing two pet hospitals in North Delhi under the name of Pets Planet India Pet Hospitals Private Limited, I truly understand the ground level challenges, hopes, and responsibilities we all carry. Buy a vet for the vet is a mission close to my heart. It gives me immense pride to share that Ori Hill Life Sciences has grown into one of the India's leading manufacturer of veterinary pharmaceuticals with a product profile of 180 plus products. But beyond numbers, what truly defines us is our purpose. We are a company, buy a vet, exclusively serve the vets. Everything we do, be it innovation, education, or support, is centered around empowering our veterinary community. We are here with safe, trusted, and first in India veterinary solutions. Our product portfolio includes India's first 100% free, safe, and sugar free and side effect free herbal medicines range, and with a large profile of first in India therapeutic medicines, injections with nutraceuticals. A robust range of neuro, cardiac, ophthalmic, dermatology specialty products tailored for small animals and vets' needs. Strengthening veterinary knowledge across India under our initiative Buy a Vet for the Vets. We have created one of the largest platforms for continuous veterinary education. Through regular webinars, we aim to spotlight advanced yet often unexplored topics like feline medicine, cardiology, neurology, radiology, ophthalmology, and now avian medicine. Your support is our lifeline. Friends, this journey is only possible because of your unwavering support, which we truly admire and we truly need. Every step we take forward, every educational effort, every new product is fueled by your belief in us. We humbly request you to support this mission in whichever way you can. Even a small order, a word of encouragement, or referring us to a fellow vet, each gesture keeps this mission alive. Ordering is just quick and effortless. Just call or text us on the number mentioned in the chat box or in all our brochures or mails. Our team will personally connect with you to take your first order. We promise highest trade margins to veterinarians. Let's walk this path together to grow, to learn, and to raise the standards of veterinary care across the nation. Thank you for being with us today and being part of this journey. Dear fellow veterinarians, nowadays, almost every small practice is seeing more and more avian and exotic animal cases. While many clinics still feel unconfident handling these patients, including of me, this segment is rapidly growing and creating exciting new opportunities in veterinary practice. To help vet begin with this journey confidently, Ori Hill Life Sciences has organized this special webinar series covering avian anatomy, nutrition, common diseases, diagnosis, treatment, and anesthesia protocols. We are privileged to have with us renowned exotic animal practitioner and speaker, Dr. Rani Maria Mann, who will be sharing her valuable practical knowledge and experience with all of us today. Thank you so much, ma'am, for joining us. Now, I would like to welcome Dr. Rani Maria. Till then, I would like to introduce Dr. Rani Maria to the people who don't know her. Dr. Rani Maria Thomas is a highly accomplished avian and exotic animal specialist from India, widely recognized for her clinical expertise, academic contributions, and pioneering role in advancing exotic veterinary practice in the country. With a strong foundation in science, ethics, and compassion, she has dedicated her career to improving the health, welfare, and management of birds and exotic animals through specialized medicine, education, and institution building. She is the founder and director of Saras Birds and Exotic Animal Hospital, Kerala, a premium center committed to advanced avian and exotic animal healthcare, diagnostics, surgery, and preventive medicine. She is also the owner of Saras Birds Exotic Farm, envisioned as a model facility for ethical breeding, scientific management, conservation awareness, and client education in exotic species. Through these institutions, Dr. Rani has created a strong ecosystem that bridges clinical excellence, responsible ownership, and community outreach. Dr. Rani holds a master degree MPSc in veterinary epidemiology and preventive medicine, along with postgraduate diploma in One Health and therapeutic management of pet animals and birds. Her academic interests intersect clinical medicine and public health, with particular focus on avian orthopedics, endoscopy, soft tissue surgery, molecular diagnosis, infectious disease, and preventive healthcare in exotic species. Her research work and scientific presentations have received national recognition and awards. Her professional experience span diverse and high impact roles, including consultant avian veterinarian for upcoming bird parks, private exotic farms, and specialized avian India. She has also received advanced international training at Abu Dhabi Falcon Hospital with the F3 Falcon team UAE, Panalai Veterinary Hospital, Thailand, gaining hands-on expertise in falcon medicine, avian endoscopy, and high-standard exotic animal care. An award-winning veterinarian, Dr. Rani is the recipient of the Young Veterinarian Award for Excellence in Avian Medicine, has won multiple prizes for oral and poster presentation at national veterinary conferences. She has authored numerous scientific abstracts on avian, exotic, and companion animal diseases, contributing meaningfully to veterinary literature. A passionate educator and communicator, Dr. Rani is a national and international speaker, having delivered lectures, workshops, hands-on training session, a webinar and webinars for veterinarians, students, aviculturists, wildlife professionals, and farmers across India and abroad. Hello,
Yeah.
Doc.
Am I audible now?
Yes, Doc, you are
Hi.
audible.
Can you guys see me?
No, we cannot see you. And that's why I'm saying if there is some problem with the camera, please try to share your PPT. Let's start with the PPT with
Yes,
your
yes,
voice.
yes. So that's okay. I will share my PPT.
Let's
Yeah.
see
Can you
whether
see
we
my
can see your
PPT now?
PPT or not. And we are sorry,
Can you see my
guys.
PPT?
Yes, we can see your PPT. So,
Okay,
Dr. Rani
perfect.
Mania, you can on your profile, you can upload your picture. We will have to work with the
Yeah, you can
picture
see,
only.
follow me on Insta. You can see my face.
Yeah.
So sorry guys for the delay. So without much further delay, let's start. And thank you so much. I am grateful to Ori Hill to give me this wonderful opportunity. I was one of the participants just like you guys long back. So I'm so happy and thankful that you guys gave me an opportunity, and it's really a blessing, and it's really a thing to present for Ori Hill. So thank you so much.
Doc, you deserve it. Yeah. And thank you so much for
No,
being
no.
here. Thank you so much for being
Yeah,
here.
yeah. Thank you so much.
Almost
So let's
300 people
start
have
the.
already joined the meeting. We can proceed with the lecture.
Yeah, sure. So the thing is with avian anatomy, so all of you know that avian medicine is big thing. Like many vets are trying to work on avian, so it's very difficult, you know. The thing is you have to start with the anatomy. Even anatomy and physiology in this session, even anatomy, like any anatomy, can be quite boring. So I have just started off with, like, there is only 25% of what is what you have to learn. So I'm not talk a lot about the important, and I'm going to talk about few systems, and you will have to work on it more. So understanding this, you will understand what has to be done from your part. Okay, so this is when we talk about avian anatomy, this is it what we will be talking about. There's a brain, eye, bill, a small intestine, cloaca, air sacs, that is all different from mammals. So if you see the class Aves, there is approximately 30 orders, 180 family, and 2000 genera. Just imagine there are 10,000 species of birds. So there are special anatomical peculiarities for each species. It's impossible to cover it in one lecture. And the main thing of a bird is what? They have a horny bill, they have feathers, they have lightweight skeleton, they can lay eggs. So that these are the common characteristics of the class A's. And one thing that you have to understand is that they have relatively high body temperature, which is often 40 to 40 degrees Celsius. And this you should always keep in mind, because I have seen lot of vets giving paracetamol to bird or writing in their prescription, oh, the bird is having fever, which is a blunder. Because in general, because of their high metabolic body rate or high metabolic activity, generally birds have high body temperature. You shouldn't confuse it with fever. And never, from whoever is attending this class, never write in a bird's prescription that the bird is having fever. Okay, so this is all little knowledge about, everybody knows that they evolved from a common ancestor, the feathered theropod dinosaurs. And so because they have, this is why they have a common anatomical similarities with the reptiles rather than the mammals. So we will see few systems. I'll talk about the integumentary system, the respiratory system, and the gastrointestinal and the reproductive system in this class. There are a lot of other systems like the cardiovascular, hepatic, nervous, skeletal, a lot more. But I don't want to bore you guys with this. We'll just talk about few, and maybe in future classes we can talk about the rest of the system, or you guys can refer to it. So one thing that you have to understand with the integumentary system is that avian skin is very thin. Whenever you give a subcut injections, whenever you pluck the feathers, or whenever you do suture, this has to be there in your mind. If the same pressure that we put to suture, give suture in a dog or a cat is applied to a bird, there will be necrosis. So we have to be very careful while suturing a avian skin. Even though, so of course there are layers like the epidermis, dermis, and subcutaneous. It's very thin, and the areas which has the feathers is very thinner. Like you have to always keep that in mind. And when the areas are exposed or featherless region, the epidermis is very thick, like in the legs and the feet. Hmm? Then again, the dermis layer is there, which is thicker. There'll be blood vessels, there'll be feather follicles. So it's just similar to the normal skin. So even though it is very thin, you will have to understand that there are smooth muscles, fat, nerves, everything within the dermis. Then again, there are foot pads, which is digital foot pads and metatarsal foot pads are there like these. So these help in bearing the weight of the bird when bird stands or perches. So there are fat pads underneath. Whenever there is a bumblefoot or infections in the leg, such this is damage. Such fat pads are damaged. Then, very important, another integumentary anatomic structure in a bird is the propatagium. So every January there is the Makara Sankranti festival. So there, when the kite flying happens, lot of birds will be injured. And what happens when we go there and we do the surgery? What happens? Most of birds come with a propatagial damage. So again, it is very important surgery to do a repair of the propatagium that is broken. So one thing is, so this you see, which is a lightly vascularized, it's a web of skin. Okay, it is vascularized. Whenever this breaks, there will be severe bleeding. It extends from the shoulder to the carpus. One important thing about propatagium is there is a tendon. This tendon, which is very crucial for the flight. If you are doing the propatagial surgery, if it is not sutured properly, if you are not finding the tendon and connecting it with the broken end, the bird will not be able to fly. Simply suturing the propatagium will not help. Okay, so this is again very important thing that you have to understand while suturing the um, propagation in a bird. Then there are several accessory cutaneous organs, like cutaneous structures, like the comb. This is the comb, the wattles, the earlobes in chicken. This is a snood of a turkey. Then there are some wart-like caruncles or cutaneous papillae in some species, and also see like this. Hmm. So these are extremely vascular. Okay, this is a flying duck which have all these cutaneous caruncles. Then again, this spur, horny beak, sear, all these are nothing but epidermal specialization. This is a spur in a chicken, of course, beak, and this is the sear. Sear is nothing but it's an epidermal specialization which is found in birds like budgies, and it is a way by which we can identify if a budgie is a male or a female. If you see this budgie, it's a male because the sear is blue in color. Hmm? It's an adult female or very old female. Because of the estrogen, it can become very brown in color as well. Hmm. Then very important organ, that gland that birds have, is the uropygeal gland. So whenever we so the thing is, uh, there are a lot of feather plucking diseases, like feather plucking cases that will come to your clinic. Okay, so I had a case. I had an online consult from Malaysia, which we were talking to the client, and she was so desperate. One problem is I was not able to. She was not able to find the medicines I was telling her. Then we tried lot of things. The bird will not improve fully. The condition of the bird was actually deteriorating. Okay, we tried changing the diet, we tried spraying, we tried giving lot of vitamins. Still it was not working. But then again she will take consultation from me. Then she will be like, after 2 3 consultations, she told me, doctor, long back what happened, there was an infection in the uropygeal gland, we had to remove it for the bird. Then it struck me, see, why it was not, whatever treatment we did was why it was not helping the bird. you know the thing is, uropygeal gland, it is a oil gland, which is a holocrine oil gland, at the see in this picture you can see, behind the tail of the bird. So there are oily secretions. So when the bird preens, this bird will take oil from this gland and it will apply all over the skin. So that will help to synthesize, that will help with the coloration of the feathers, that will help with the, see, one second, that will help in maintaining a clean plumage. So this is how they will rub that oil throughout the body. It's nothing but preening. Okay. So there are birds like emu, ostrich, some pigeons and dove, even Amazon and Pinus parrot, which is very common in Avian field, they doesn't have a preen gland. Okay, preen gland is very common in or very prominent in waterfowls. And also there is a in smaller birds, when you examine the preen gland, you will not be able to see the preen gland like this, but then there will be a small tuft of feathers that is in this region, and that is called a uropygeal wick. Hmm? So this uropygeal gland, as I said before, it secretes complex oily substances, and this is applied all over the feathers during the preening, and this will help in waterproofing, and also it will help in the feather moistness and flexibility. Also, studies have shown that this preen gland secretion, this oil has antimicrobial activity. It will help in the brightness of the plumage, which will help to attract the female during the sexual activity. Then, if you ask if there are any cutaneous glands, yes, there are few glands around the vent which will secrete the mucus. There are some ear like glands inside the ear. That's all. Apart from that, there are no sweat glands. So yes. Then another main part of the integumentary system is the feathers. Birds become so attractive because of the feathers. But what we have to understand is that these are just not feathers are nothing but they are modified scales, which are primarily used for thermoregulation, and their use in flight is nothing but a secondary adaptation. Of course, we know the skin is very thin. The feathers will definitely protect the avian skin from this injury, harsh ultraviolet light. It will help in waterproofing and territorial display and communication. It's a keratin based structure. So there are, it's not like if you take a bird, the bird is fully covered with feathers. It doesn't form like that. So there are specific tracks through which this, feathers grow. And these tracks are known as terille. In this baby bird, you can definitely see terille. It's not like there are areas where there are no feathers, right? In this picture also, if you see, there are capital feathers, humeral feathers. So through these tracks, the feathers will be growing. And also, featherless regions are called apterillae, and you can see superficial vessels. This is the picture of a tocotucan, where in the apterillae, that is where it doesn't have feathers, we can see the jugular vein. If you try to collect, if you have ever tried to collect blood from a bird, the jugular blood collection, when we clean the area with spirit and we don't see any follicles or anything like that, so that area will be very clean or without any feathers. And second thing about feathers that we have to understand is that these feathers will not last forever. There is one complicated, highly complex process which is highly energy consuming, which is controlled by endocrine system and photoperiodism, that is nothing but molting. So a lot of people are confused. When does this bird molt? It is like the whole feathers will molt out. People are really confused. So you don't have to have this confusion anymore, because we are studying now that molting, it is the process of replacing old feathers. Okay, it will happen once or twice a year. Okay, so and it's a very gradual process, and it is very species specific as well. It is not that okay, this bird has molted so the other bird should molt, nothing like that. It's a very species specific process, and at the time only one or two flight feathers will be replaced. Don't expect the bird will molt, the bird will remove all the feathers and sit like that and then new feathers will come. No, it will molt only one or two feathers, and it's a very gradual process. This is why whenever we talk about feather plucking disease, or whenever we are treating a feather plucking condition, you shouldn't give hope to the owner like, yeah, this will clear up in 1 week, or this will clear up in 1 day, or like 1 month. See, you should give them the idea that it can take, feather conditions will take definitely 6 months or 1 year or at least 2 years to improve, because that is how much a feather, new feather will take to grow. So this has to be properly communicated with the owner. And next important thing regarding this molting or new feather is something known as blood feathers. We often get lot of calls from clients, panicked clients. They're saying, oh my God, there is, doctor, there is a lot of blood that is on the floor. We don't know where this blood is coming out. A lot of bleeding has happened. Will my bird die? This, that, and all. So it is nothing but a broken blood feather. Blood feather is again nothing but a new growing feather. This new growing feather has lot of blood supply. Okay, axial artery, vein, everything will be encased in a keratin sheath. So what happens when the bird, this is very fragile, and when the bird falls down, this feather can break. So what you can guide is, you either ask them to bring to the clinic, or you just guide them to what has to be done at the house. So what do you tell them? So basically, when a blood feather is broken, what you have to do is, you have to take an artery and just pluck the whole feather. There is no point in trying to control the bleeding, trying to, mopping that area. It is not going to happen. You just take an artery, pluck the whole feather, and just press that area for 2 minutes, and it will be okay. That's what you have to tell the clients as well. And also imagine, when if a bird is brought to your clinic for wing trim. So we trim the feathers, and what happens eventually, sometimes by accident, we will trim the blood feather. Again, this bleeding will happen. So that time also, don't panic. Just take an artery and pluck the blood feather out, and the bleeding will stop. Okay. So that is about blood feathers, which is very important clinically. And this is how this is actually a image. This is not the bird. This is how the bird will be looking. So there'll be a keratin sheath, which becomes clear, and it will be removed by this thing, what, preening. So this is the pin feathers that will be formed during the uh, molting. Okay. Again, when you examine the feathers, see, just by observing the feathers itself, we can understand a lot of thing about the condition of the bird. Imagine there are a lot of stress lines or stress bars like this in the bird. It is a sign that there is some malnutrition, some disease, or some exogenous steroid administration, or even some drugs like fenbendazole can result in stress bar formation in birds. And also, one thing is this thing, whenever there is a liver issue, imagine the liver is badly affected, the birds can definitely end up having darkish discoloration of the feathers. So just by checking out the feathers we can understand a lot of things, and it is very important you observe the bird as a whole when a bird comes to you. Okay, so that is with the integumentary system. Let's talk about the respiratory system. To start the respiratory system, we have the opening of the respiratory system, the nostrils, which has a sensitive epidermis, which is known as the cere. Cere is often bare. It won't be having any feather or something like that. In most cases, there won't be feathers. They can. So this is a cere in a pigeon. This is in a lovebirds. This is in a eagle. Yeah, cere can be seen in different size and shapes. Mm. Then sometimes there is an operculum. This is the operculum, which is very common in turkeys and chickens. So the thing is, sometimes when we do nasal flushing, there can be hemorrhages that is happening. So that is not a problem because this operculum has lot of blood vessels. So even if a little bit of bleeding happens, you don't have to worry because the underlying epithelium is vascularized, so it is not an issue. Then very important thing with the respiratory system that you have to study is the this slit. Okay, so whenever I take an online consult or whenever I take a patient in my clinic, first thing that I check before after opening the mouth of the bird is see the choanal papillae. This is the choana of the bird. Huh? This is nothing but a septum, nasal septum. Okay, so you see this slit and see you see this papillae. If the papillae is all right, if the finger-like projections are all right, there is no discoloration, there is no blunting, it means that the bird is healthy. If the papillae is damaged, means if there is some blunting, some whitish discharge, whitish spots, or some mucus that is there, that means there is some sort of respiratory or some sort of gastrointestinal tract issue for the bird. So observing the choanae and understanding what is choanae and choanal papillae is very important during a avian examination. It should be a part of regular part of your avian examination. Second thing is intraorbital sinuses. It is nothing but a C-shaped structure. So one thing is it is not fully encased in a bone. Lateral wall is skin. So that is why whenever there is a sinusitis, there is bulging. Intraorbital sinus bulging happens in most of the birds. Hmm. And also, there is no ventral drainage for intraorbital sinus. It opens into the nasal choanae. There is a dorsal drainage. So that is why, because ventral drainage is not there, sinusitis is very difficult to treat in birds. I have seen lot of people treating for sinusitis. There'll be bulging. There'll be, they give lot of antibiotics. It's extremely difficult. You will have to do nasal flushing. Uh, you will have to do. Sometimes you will have to you will have to operate it and put a stent through which drainage can happen. Otherwise, it's going to be very difficult to treat a sinusitis in birds. So it's not your problem. It's because there is no ventral drainage. Then trachea. Trachea, the anatomy of trachea, where there is no epiglottis. Okay, if you see the trachea, see, this is the tracheal opening. Just when we open, we can see the trachea just below the tongue. Okay, this anatomical position makes endotracheal intubation very easy in birds. Okay, there is no epiglottis. It is very easy to intubate the birds, and also it's a good thing and it's in one side it's a bad thing, because when you give crop feeding or when you do oral feeding in birds, because there is no epiglottis, there are high chances that the food can go inside the trachea and there can be aspiration. And if aspiration happens in birds, it is going to be a very end stage thing. The bird can die immediately. If the bird doesn't die, there can be chances of, some bacterial or yeast infection, that is some damage to the lungs, trachea, internal organs. It's going to be terrible. So one thing about birds not having epiglottis is easy intubation. Bad thing is high chances of aspiration, and also they have complete tracheal rings. So again, you cannot use your normal one second. You cannot use your normal cuffed endotracheal tube. If you use cuffed endotracheal tube, it can be disastrous. It can cause necrosis and damage the trachea. So always make sure that you use uncuffed endotracheal tubes in birds. Okay, never use cuffed tubes. And also trachea comes in different sizes. You can see amazingly coiled and long trachea in whooping cranes and swans. The shape of trachea of penguins are different. You see, you just type on different anatomy of trachea, you can see a lot of amazing tracheal structures. And compared to mammals, trachea, birds do have long neck, right? So the trachea is also long. Yeah, this keep in mind, you have to. So whenever you will learn anatomy, there'll be some clinical tip that is associated with anatomy, so you will have to study like that. Okay, again, the Avian box syrinx is at the tracheal bifurcation. Okay, so this is the syrinx. um, so because syrinx is at the tracheal bifurcation, there are chance of birds, you know, when we anesthetize the bird, they can vocalize during intubation. That is okay, don't worry. And also, this syrinx is the area where we see lot of fungal spores or foreign body. They lodge it there. So whenever there is a voice change in the bird, a normal bird would suddenly start having voice changes, always think of something that is causing a blockage in the syrinx. Okay, so that is very important. It's usually a fungal granuloma. We have seen, so long ago when I was doing my internship at Falcon Hospital, we had a case of a falcon which came with sudden, it was not sudden, it started making sound like it's choking, a weird kind of sound. Because the doctors are so expertise in this case, they sedated the bird and they quickly removed the granuloma from the syrinx of the bird. So whenever there is a change in the voice of birds, always never ignore the problems in the syrinx as well. Then there's the lungs, which is closely attached to the vertebra. Then see, you must have seen a lot of pictures where people auscultate the birds like this, but then this is not a correct way. You will have to auscultate from the dorsal side of the bird. Okay, because lungs are located towards the dorsal. So yeah, but then because of the severe heart sounds, it is, unless and until there is a severe lung pathology, like a big lesion in the lungs, we won't be able to appreciate lung sounds. Or unless and until there is a severe aspergilloma that is blocking the air sacs, we won't be able to appreciate it properly. Yeah, even heart rate, counting the heart rate doesn't make sense in birds. If you want to check the breathing of birds, just keep the bird in a cage, or count the breathing once the bird is resting. Otherwise, you holding the bird, putting a stethoscope, you can do it for take a picture, but then it doesn't make sense. You are not able to get much from this. So yes. Then one important thing that birds have is the air sac. 80% of total volume of respiratory system is makes up to air sacs. Okay, air sacs are nothing but thin, delicate, lightly vascularized membrane. So because of the presence of air sacs, we are able to use the magnificent instrument, the endoscopy. So because air sacs are there, whenever we do a cilioscopy to examine the birds, we puncture the air sac and we see inside of the birds. Endoscope is a beautiful equipment through which we can understand the liver, we can understand, see the spleen, kidney, bronchoventriculus, heart, lungs, air sacs. If there is any granuloma, we can see the testes or ovaries if they are functioning properly, if they are mature enough. A lot of things can be understood by doing endoscopy in a bird. So that is possible only because air sacs are present in birds. So basically, there are 9 air sacs, one unpaired air sac, which is the clavicular air sac, this one, and rest all are paired air sac, like the cervical, thoracic, and abdominal air sac. Okay, this is the abdominal air sac. This is the posterior thoracic, anterior thoracic, cervical air sac, and the clavicular air sacs. So these are the air sacs. So whenever this is the ostium of the lungs. This is the endoscopic view. So, and air sacs extend throughout most of the part of the body, including skeletal system. So, if you have heard about pneumatic bones, that is found in avian species. We know that yes, humerus and femur are pneumatic bones, but then sometimes sternum, coracoid, cervical, and thoracic vertebrae, pelvis can also be pneumatic. In some species, so so this is what we say the pneumatic bone. It is connected to the air sac. This is a humerus. So if you must have read about intraosseous catheterization, which is a very fancy thing to avian patients, it doesn't give us much. It's not that rewarding, it's not like it comes under the emergency procedure, but it's not like whenever a bird comes to you sick and tired, you put an intraosseous catheter and we can magically save the bird. It doesn't work like that. So yes, so intraosseous catheter, never put it on humerus because it has connection to the air sacs. And also whenever you get fractures of the humerus, make sure that you don't wash it and clean it so much because this water can go inside the lungs. So you have to be very careful when you treat fractures of the humerus as well. And if you are putting the intraosseous catheter, it is the ulna or tibiotarsus should be the uh, this thing bone of choice. But then there are few species where even ulna is pneumatized, so you have to be extremely careful. Then the gastrointestinal tract, yes, there is the beak and the bill, which is again keratinous structures. Then as we discussed before, this also comes as a part of the gastrointestinal tract and also respiratory tract. There is the choanal cleft, choanal slit is there, choanal papilla is there. Choana is nothing but a fissure or a space between the oropharynx and the nasal cavity. So whatever infections happens in the nasal cavity or the oropharynx, this choana is affected, poor thing. Again, there is a big tongue for the bird. If anybody of you has not seen the tongue for the bird, next time a bird comes to you, you should definitely see the tongue of the bird. Then there aren't much well-defined salivary glands. There are small areas of salivary tissues on the floor, cheeks, and roof of oropharynx. That's all. There is nothing much like a prominent, well-defined salivary gland. Then, because I was searching about glands, I found something known as salt gland. It is nothing related to the gastrointestinal system, but I thought it will be interesting. So, when there are birds like seabirds and shorebirds, which consume lot of salt water and eat saline food, how do they not become dehydrated? Because they have lot of, they take all this saline. So they have a specialized organ known as a salt gland. It is secreted like just above the eyes. So this is where the salt gland are seen. So they act like extra kidney to excrete the sodium chloride from the bloodstream. See, it can be excreted. It will be excreted like this, a drop of water at the tip of the beak. So that's a salt gland. And yeah, so that's how they, if somebody asks you like, and also these salt glands are present in sea or this turtles also. So yeah, we might think that they must be crying, but it is not crying. It's like excretion of this excess sodium chloride from the bloodstream. The next important thing is a crop. When we understand the crop, when we understand birds, one important anatomical structure that we shouldn't ignore is a crop of the bird. Whenever a bird comes to you, as a general physical examination, As I said before, you should definitely check the choana of the bird. See if choanal papillae is okay, if it is blunt, any infection. Second thing, you will have to palpate the crop. Many times we get vomiting because there is some foreign body in the crop that is stuck. Then second thing is, if a bird comes to you and people say that, oh my god, doctors, the bird is not eating for so many days, but still when you palpate the crop and you see that there is food inside the crop, that shows that yes, there is some sort of crop impaction that the owner has missed. So in such cases, there is no point in giving lot of antibiotics. First thing you have to do is you will have to empty the crop. Only then things will work. So crop is a temporary area where there'll be temporary storage of food. And one important thing that is associated with crop is crop burn. When we speak about nutrition, we will definitely speak about when we give hand feeding formula to baby birds, right? So this formula should be in a temperature of 39 to 40 degrees Celsius. There are a lot of people who make mistake of giving a formula which is of higher temperature like 44, 46 degrees Celsius. And as we discussed, the skin of bird is very thin. If this very hot formula goes inside the body, there'll be burn happening in this crop region, and we'll have to do a crop surgery. So crop is very important in lot of ways. You should definitely learn to identify crop. And it is not like and also we have crop milk that is in the pigeon. This is the anatomical this structure of crop in different stages. This is the anatomy of a crop of a bird which is non-breeding bird, which is during the breeding season. They become so big and glandular. Then don't expect presence of crop in every bird. Birds like owls, then gulls and penguins doesn't have crop. Toucans and turacos doesn't have crop. Okay, so don't expect every bird to have crop. There are birds which doesn't have crop as well. Then comes the proventriculus and the gizzard. As you all know, proventriculus is again an important organ. In many cases, when macaws come to you with vomiting, when we do the radiograph, there is a proventricular enlargement. That is nothing but a Borna viral infection, which is a viral infection which is known as the macaw wasting disease or proventricular dilatation disease. So to understand that, yes, birds have proventriculus is very important. And during the radiograph, to take measurement, to understand how to take the measurement of the proventriculus is also very important, so that we can understand if there is any enlargement or anything like that. So proventriculus is a very important organ in birds. This is the stomach. So basically, this A is the proventriculus, this region is isthmus, and this is C is the gizzard. Gizzard has a coilin layer which protect the serosal surface, because some birds which takes grains, they take a lot of grit. So this grit will have sharp ends, so it shouldn't be damaging the serosal surface of the ventriculus. This is yellowish due to bile staining. So this is the gastric anatomy. There is a esophagus, crop, proventriculus, gizzard, pancreas, which is in the duodenal loops, ceca, cloaca, large intestine. This is very common, you guys know. Then towards the end of the gastrointestinal tract, we have the cloaca or the vent. Many times we take samples, instead of taking the poop sample, we take a cloacal swab to understand bacterial or yeast infection or growth inside the body. And also the gastrointestinal contents empty into a part known as coprodium. And the uterus and the ovary empty into urodium. Okay. Then this is what we discussed. Birds like pigeons, dove, free-ranging gallinaceous bird, ratites, they require grit in their food, which will help to grind the seeds that they eat. But there are few honors like honors of passerines and citizen birds. They also give grit to the bird, so that is not required. If they consume excess of grit, that can result in impaction. So make sure that grit is not provided to birds like citizens, because how they eat the seed is they just take one seed, they break it open, they eat the seed hull inside, like seed the seed kernel inside, not they don't eat the shell. But other birds, granivorous birds, they eat the whole thing. So we don't have to provide the grit. Then towards the final part of reproductive system, we have the like anatomy, we have the reproductive system. So we know that. So what we have to understand is that if some owners come to your clinic and ask, doctor, can you tell me if this bird is a male or female? Most species, it's very difficult to tell from morphology. Yeah. So towards the last part of anatomy, we'll speak about the reproductive system. And what you have to understand is that after attending this class, you guys shouldn't feel like, oh my God, this we have learned everything about anatomy. There are still a lot to be learned. And because there are, as I said, there are around 10,000 species of birds. If you take each bird, like see, poultry is different from a macaw, macaw is different from a toucan, toucan is different from a hornbill, hornbill is different from a emu, emu is different from a penguin. So avian thing is really amazing that you can find, you can learn anatomy of each different species. So yeah, just take it as a beginning, uh, and then start learning more about it. Okay. Then coming to the reproductive system. So as I was telling, if a client comes to your clinic and asks you, doctor, can you please help me find if this bird is a male or female? Don't like sometimes we do it in small cats, no? Small cats, when it is very tiny, it's difficult to tell. So sometimes we'll say, ah, this must be male, female. It doesn't happen in birds. So because most birds are not sexually dimorphic, so it is very few birds like we said, budgie, where the seer is blue in a male and light colored in a female, and there is a king parrot, uh, where the male has a yellowish base tail, not yellowish, orangish base tail. Then there is one bird which is very prominently sexually dimorphic is the what eclectus parrot. Eclectus parrot, I'll show it in the nutrition slide. Eclectus parrot is something which has male is green in color and female is red in color. So they have sexual dimorphism. Then hornbills. Hornbills also has sexual dimorphism. Apart from that, other birds, if you show a macaw, it's very difficult to tell it's a male or a female. So in that cases, you will have to suggest them to do a DNA sexing. DNA sexing is nothing but you can do, there are labs in India which do DNA sexing. So either you pluck few feathers of the bird and put it in a Ziploc cover and send it to them. They can do the analysis, or else you can send a blood sample. You just cut a little of the toenail, put the blood in a paper, and again dry it and send it to the lab. Definitely, you can understand the DNA sex, male or female, the sex of the bird. Again, one most amazing thing and most clear, see, the problem with the lab diagnosis, the PCR DNA sexing is there can be mistakes. Okay. But one clear short way of knowing if the bird is male or female and also bird is in a reproductive stage is the endoscopic sexing. You can definitely know if the male and female, if it's a male or female, if it's a male or a female. So if you have the facility to do endoscopy, that is the best way. Coming to male reproductive system, they have a paired oval or bean-shaped testis. This is the testis. It is located dorsally, dorsally, either side, or like there is a vertebral column, and it is close to the lungs. Okay, there'll be kidneys in the cranial part, and there'll be air sacs. So whenever we poke the air sac and see if it's a male, we can clearly see the testis. And don't always think that the color of testes will be light colored or reddish brown like this. There are black birds with black testes, which is like cockatoo, myna, toucans. They have gray to black colored testes. Don't tell that, oh my God, this bird is having some anthracosis, some. Don't say such things, because it is the color of the testis, which is black in birds like cockatoo, myna. So it is very important before you do something on a rare bird, you'll have to definitely read upon it. If you're going to do an endoscopy of a cockatoo, just read upon it, and then you will understand, yeah, this bird might have a, if it's a male, the testis is going to be black. So you don't have to be scared or panicked. Then again, coming to the reproductive thing, there is a cloacal promontory, which is a site of sperm storage, especially in passerine birds. So there are a lot of cases where if birds are not, if the owner is not very, not very sure about bird keeping or is first time, they bring the bird to us like this and they say, "Oh my God, doctor, there is a bulge. What to do?" So for you also, if it's a male bird in passerines, yes, of course we can understand male female. If it's a male bird and if it is having a cloacal bulging like this, it is nothing but a sperm storage site. Don't go and operate it, or don't go and like to pierce it and see if it's an abscess or anything like that. Please don't do all that. Understand that it's a cloacal promontory and it's a sperm storage site. Then usually birds breed by cloacal kiss or cloacal touching, but then there are birds which have a copulatory organ known as the phallus. This is especially in ducks. This is the phallus. That is with the male reproductive system. With the female reproductive system, they have the left ovary and the left oviduct. The right ovary is rudimentary. We rarely see it. Okay. Uh, so when we do the endoscopy, we can see the ovaries like this near the kidneys, and also this is the adrenal gland. This is the ovary of different stages. This is in a very young bird. This is also a young bird. This is very reproductively active ovary. Hmm. Again, this is the, when we study the ovary, there is the ovaries, infundibulum, magnum, uterus or the shell gland, isthmus, vagina, and cloaca. Correct? So that is with the anatomy of the birds. I will just quickly start with the, where it is, avian nutrition. So anatomy, as I discussed, don't think this is the, it's impossible to talk a lot about anatomy because even I don't like anatomy so much. Um, I used to sleep all the time in anatomy classes in school, in college. So yeah, I'll start sharing the avian nutrition. Can you say if it's visible? The nutrition slide is visible or not? Anatomy, I hope you must have at least got three or four things to take back home. I'll just repeat it again. Anatomy, when it comes to anatomy, you'll have to understand what is a choana, choanal papillae. That should be included in your day-to-day daily examination of when a bird comes to you. Second thing is feathers. When you see the feathers, you should be able to understand what is the condition of the, whether it's a molting, whether it's a blood feather, whether it is having any stress lines. It can be indicative of malnutrition. Any sort of discoloration in the feather, it can be a sign that the liver is damaged. Then again, coming to the respiratory, trachea. Trachea is a very important organ. Understand that there is no epiglottis. Very carefully you should administer the crop needle, or when you're feeding the bird you have to be extremely careful because epiglottis is not there. You can aspirate the bird and kill the bird. And then epiglottis is not there, one good thing is you in endotracheal intubation is extremely easy. Always make sure that you don't use a cuffed endotracheal tube, use a uncuffed endotracheal tube. Okay. Then reproductive system also, then air sacs are there that will help us to do the endoscopy in a better way. When you put introducious catheter, choose this bones which doesn't have a connection to the air sac, that is ulna, tibiotarsus, or in common birds you can use. So that is with the anatomy. So whenever you study anatomy, always think about the what is the clinical relevance of each anatomic structures. Okay, so then let us talk about nutrition. Nutrition, in this picture itself you can see a wide variety of birds. Like see, like this is a macaw, this is a cockatoo, eclatus, lorikeets, uh, this is another type of cockatoo, kite. So in this picture itself, all these birds require different kinds of nutrition. So again, this is a hornbill. Hornbill again requires a different type of nutrition. So nutrition in bird is extremely important, because one thing is most of the disease in birds happens because of poor nutrition. or ignorance of the owner. Sometimes this lorikeet is a bird which requires more of nectar or soft food in their diet. I've seen a lot of owners giving all these seeds to this such birds, so that can definitely damage the internal organs in birds. So avian nutrition is very important. Whenever a bird comes to you, as a part of the history, taking a detailed history about what is being fed to the bird is very important. Understanding what is being fed to the bird will help you understand a lot about the underlying disease condition of the bird. Okay. So in general, now the ideas has been changing, but then in general, people feel that birds eat only seeds. So I have seen a lot of people giving seed only diet to the birds. The problem with seed only diet, especially whenever it's a oil seeds like this groundnut, sunflower, safflower, the problem is that they are more of fat. That is more than 50 percentage of them is fat. They are high in energy. Omega 6 is more. Calcium is very less. Vitamin E is more. Yes, okay. Calcium is very less. Vitamin A is less. Rest all vitamins and minerals are very less in seeds. Of course, flax seeds have omega 3. It's not like you can give a lot of flaxseed to the birds. Then there are non-oily seeds, which is again lower in fat.
Thank you.
So yes, there are. So when it comes to oily, like seed diet, there are oily seeds and non-oily seeds diet. But then just cereally diet doesn't make any good for the bird. So I think most of the clients, when they come to your clinic, they must be saying, my bird just eats seeds or it eats roti, chapati, like that. Again, that is again a red mark which has to be noted, which is going to be very bad for the bird. Then again, in the wild, if you see, birds generally can balance diet. So when we say birds can balance diet in the wild, it's like they balance the energy, amino acid, and calcium in the wild. But then the problem is in the captivity, they won't be able to balance it properly because they eat what we give. In the captivity, when studies, uh, so whenever birds were given a seed diet, it was shown that they were deficient in lot of dietary components. Okay, so it's not like you just give them seeds and they can balance everything themselves. It doesn't happen that way. Of course, they will become deficient in lot of vitamins and minerals. There's again few studies which shows that just giving seeds, the birds were deficient in vitamin A, D3, E, K, amino acid, calcium, minerals, and also these oil seeds have lot of energy, which is concentrated energy. It will result in weight gain. So that is also not good for these birds. Then sunflower seed is something people give it in like ad libitum to birds, which has to be controlled. So in the upcoming slides, we will be seeing a diet chart. In that, what we see is seed should only be 10 percentage of the whole diet. But in most cases, what we see is it will be 100 percentage or 90 percentage seed based diet, which is extremely bad. But yes, of course, you can keep sunflower seeds in your clinic if you're admitting the patients. The birds will love to eat sunflower seeds. So that is a good source of energy for birds which are anorectic. Apart from that, on a daily basis, avoid giving sunflower seeds. But then now we have formulated diet, right? There are pellets and extruded diets. So they are nothing but like kibbles in dogs. They are based out of grains, which is fortified with amino acids, vitamins, and minerals. So the thing with I like giving formulated diets like pellets and extruded foods to birds, but the problem is we cannot give it long term. I have seen a lot of patients end up having kidney problems if you're giving it long term. So try to incorporate it like a 10 to 20 percentage in the diet rather than giving it as so they label it as a complete diet where we can just give just pellet to the bird. So I wouldn't recommend that. And also from my experience, I have seen a lot of patients end up having liver and kidney issues by just giving pellets. So just give it a part of the diet. That works. Hmm. And also problem with formulated diets like these pellets and extruded food is that they can be a little expensive, and also the bird, if the birds are not used to eating this, they can end up having not liking it. So that is also issue. Then there is lack of enrichment. So when you give seeds or when you give some fruits, there will be, they will be biting and they will be searching for the, like, there is some sort of enrichment that can be done. Like we have, you can cut the fruits and just put it in a stick and hang it in the cage, or just hide it somewhere and give it to the bird. Or if you can give a whole coconut, they can try to open the outside and just try to take the things inside. So it's all a enrichment. When you give only pellets, there is not much enrichment, or there is no fun in eating. It becomes too mechanical. uh, so yes, so that is, those are the different kinds of food. And then whenever a patient comes to you, this is what I said you should be asking. Determine exactly what the patient is fed, okay, and in what proportion. You have to understand if the bird is getting an excess, adequate, or inadequate levels of fat, vitamins, protein. Hmm? Then how often the bird is fed, what time the bird is fed. A lot of things has to be asked. If the bird is given any treats, what is the source of water. I don't know if how many of the vets, so if it was not an off online class, I could have asked you guys, uh, like how many of you actually ask from where you keep the water. See, what is the source of water is very important. Where we place the water bowl in the cage is very important. How often we remove the water is very important. Whether we remove the water at night is very important. See, because, so how many of you ask questions regarding uh, like water? Any of you? Yes,
Nobody.
Yeah,
no.
ma'am, I would tell them
I
to
think all
kind
of
of change once a day. And then usually I tell them to keep the water bowl really clean and
yes.
change it once in the morning. And if we
Huh.
are mixing medicine, then I tell them to change at least twice a day.
Yes. Okay. Okay. So yes. So asking about water is also very important when it comes to history taking. See, first thing is you have to ask them what is the source of water. Whether it's a tap water or boiled water or RO water is very important, because if it's tap water and all, there are high chance of E. coli infection in the water. Second thing, make sure that the water bowls are not kept just below the perch. I've seen a lot of people keeping water bowls just below the perch. What happens when the bird poops? This poop straight directly goes inside the water. Then that can also contaminate the water. And also try to keep the water away from the food bowls. Otherwise, what will happen? These birds will take the food, they can dip it in the water, and this food will stay there, and that will act as a source of bacterial growth. So that can also act as a source of infection to the bird. Then thing is, if it's a big aviary and all, if you are removing, keeping the water bowl throughout the night, what happens? The rats will, of course, be there in every aviary in India. So these rats will walk on top of the cage and they will pee and poo in this water bowl. Next day morning, the bird will drink this water. Again, there are chances of infections like Pasteurella, E. coli, Klebsiella, etc. Uh, uh, then one thing you have to tell them is, see, if it's antibiotics, antifungal and all, you can definitely mix it in water, but definitely avoid mixing any multivitamin, probiotics, or any supplements like that in the water, because all these supplements, any calcium supplement, vitamin supplement, they are like sweets, right? Once you mix it in the water, it will become like a broth, huh? Like a broth, and bacteria will grow, and then if the bird keep drinking it, that can cause infection. So always provide, unless you are mixing a medicine like an antibiotic, an antifungal, or a dewormer, avoid mixing all these multivitamin or like multivitamin mineral supplements in the water. Mix it, give it in the food. Okay, so these are the things that you have to keep in mind when it comes to water. So all these things you have to ask the owner. Nutrition, it's very simple, but it is very powerful. It forms the basis of most of the disease. It forms the basis of most healthy condition of the body. It's similar to us. See, if we are eating good food for like 6 months, we'll have glowing skin, our weight will drop, we'll look amazing. But then again, if you are eating one bad food for the next 1 month, bad health, right? It's same in birds. People must have read like, okay, macaws can live up to 70-80 years in captivity, but then most of them end up dying by age of 10 because of the poor diet. So that is one important thing. See, this is what, uh, birds get sick for many reasons, but main thing is environment and diet. Only the third reason comes death due to trauma. So diet and environment, very important. So in the wild, base diet of bird is seeds, nuts, grass, flowers, fruits, insects, right? But at home, birds eat what is available. So it is the duty of the owner to make sure that a good quality food is provided to your bird. Hmm? So if somebody asks you, you can note it down. If somebody asks you, doctor, can you give me a diet of the bird? What has to be fed? You can give them this. So it should have at least 15 to 20% dark green vegetables, 15 to 10% normal vegetables. You can give them animal protein like eggs, chicken, mealworms. You can give them cooked tubers, legumes, and grain, millets and candies, sprouted seeds can be given, fruits can be given, 5 to 10% seeds and nuts. See, again, if you see this, you will understand. Oh, only 5 to 10% seeds has to be, fruits has to be given. See, there are people who give like around 50-60% fruits. Again, that is not good. And also, when you tell them to give the fruits, you should tell them give raw fruits. That is better. If you give too ripe fruits, what happens? It has lot of sugar, and that can result in fattening of the bird. Again, seeds you have to be very careful. Nuts you have to be very careful. It should be a balance. Then again, when you have to pick vegetables, you can take beetroot tops, broccoli, cabbage, spinach, drumstick leaves, sweet potato they love to eat, pumpkin they love to eat, carrot they love to eat, fruits, apple without the seeds you can give, papaya, pomegranate, guava, mango, plum, watermelon, sugar cane, all these things they love to eat. So the idea is fruits, just give try to give unripe fruits, don't give overly ripe fruit over a long period of time. Okay. Yes, of course, nuts you can give. So people they might think giving nuts to bird is a luxury. No, if you have a macaw, giving nuts to the bird is of course this hazelnut, macadamia nuts, Brazil nuts are really expensive. But then if you have a macaw, it is not a luxury, but it's a necessity for these birds. Okay, it is very important to give nuts to your birds. Then uh, these seeds can be included like yellow, white, red millets, sunflower seeds, buckwheat, mung beans, paddy, hemp seeds, niger, but their quantity should be very less. But then you will get specialized seed mixes like this for each bird. Delhi Nature is just one brand that I have mentioned, but then there are a lot of brands which make these seed mixes, which you can either keep in your clinic or ask the owner to buy and give it. Then animal foods. Birds can definitely eat. They love to eat eggs. They eat chicken. So this is an ecletus, female ecletus parrot. As I said before, it is red in color. Hmm? Then they can eat mealworms in the wild. Hmm? The ecletus parrot, and this is a male ecletus parrot, which is red in color, and a gray parrot enjoying crab. And then you can give special food like ginger, turmeric, aloe vera, cinnamon. It's not like you chop it and you put it in the food plate, they will eat it. This is like a treat or a special food. If they eat or they nibble out, it can be beneficial for them. So what you do is, if you just imagine you take some aloe vera, you turmeric, and you chop it and you give it to the bird will not eat it. So what we usually do is we put it on top of the cage of the bird so that bird will think like, oh, what is this? This is something new thing. Let me just nibble and see. Like we handle a small kid. Like if it's a small kid, we tell her that, okay, don't take this thing. She'll be like, oh, she want it, right? So just like that, you will have to handle a bird. So if you just put it on top of the cage, the bird will be like, oh, that is something that I shouldn't touch. Okay, let me just see what it is. So they will just slightly nibble the thing, and yeah, that is enough. So such things, flowers, cinnamon, aloe vera, turmeric, and all, you can cut a small piece and put it, and the bird will enjoy it. Then generally the diet should look like this. It can be a mixture of all these Yeah, sprouts. In this sprouts, veggies, green leafy veggies, pumpkin, radish, beetroot, everything is there. And if seeds also, it should look like this. It's a mixture of all sunflower seed is the main thing that we have to understand. Can look like this. Then that we shouldn't give. Avocados. Now most of us as health conscious, we will have avocados in our kitchen, but avoid giving avocados to bird because it can result in cardiotoxicity. Alcohol, caffeine, sugar, and salt. I see a lot of people, especially in the north. Uh, Clients come to me and they are like, ah, doctor, my bird eat only this thing. Whatever we eat, she wants. The biscuit that we eat, she wants. The kurkure, she wants. The ghee and all these things the bird wants. But then it can, badly affect your birds. Understand that, and yeah, it can decrease the lifespan of bird to a great extent. So again, these are the fruits that are not recommended. In this, we say grapes and bananas, try to avoid because they are high in sugar. So high in sugar can result in excess body fat, and also birds like lorikeets. Lorikeets, we will have a detailed discussion of their diet. Lorikeets, avoid fruits which are rich in vitamin C and iron because they end up having iron storage disease. Okay, so that is very important. So that is with the general diet. Now we will see the neonatal nutrition. If a baby bird comes to you, how can you suggest what can you suggest owners to give? Imagine they buy a new bird and they are like, doctor, please suggest me something, know what to give, how to give, and all. You should be very clear about what has to be given. Okay. First thing you have to tell them is you have to follow a strict hygienic protocol. Like we handle a small baby, human baby or small like puppy or a kitten, you have to be very extremely careful with baby birds because they can get infection really fast. You have to clean your hands before feeding them. The crop needles and the syringes should be disinfected. You can use substances like Virkon, which is safe. So that hygiene is very important before you handle a baby bird. Then there are different hand feeding formulas that you can use. I have just mentioned few. It's not like I don't use any of this. I use something a different thing known as Supreme. I use Better Farm. Better Farm has a product known as NeoCare. So I don't have issues with that. I use it. If this is available in your place, like A21, A19 is available, Extract is available, Supreme is available, Sitacus is available. All these you can definitely give to your bird. Okay. Thing is, yeah. So just not this A21. A21 with Versilaga. If it is a bird like a Amazon parrot or a cockatoo, they require less fat in their diet. Okay. So for such birds, you can definitely give medicines like hand feeding formulas like A21. Again, if it's a macaw or a gray parrot, you will have to give foods like A19. So that has to be taken care of. Then the thing is, whichever hand feeding formula you give, it is not an excellent thing. Don't think that okay, this is the best. There are little additions you can do while you give formulas to the bird. Like we sometimes add peanut butter. Um, Peanut butter is really good because when you add so if it's a fat requiring bird, like a macaw, we add 1 tablespoon mm, of peanut butter to 250 ml formula. So this is all we guide the owners to do it. And also if it's a non-fat requiring birds like Amazons and all, we add 1 teaspoon to 250 ml of formula. Sometimes if it is eclatus parrot, we crush some vegetables and add it in the hand feeding formula. Sometimes we give some fruits and vegetables to birds like lories. So such things, because this hand feeding formula is not fully complete. Then very important thing, earlier also I was telling you the temperature at which the hand feeding formula is given. It should be between, it's written 39 to 40 to 41, but always to be on the safe side, keep it at 39 to 40 degrees Celsius. Okay. So 39 to 40 is what you have to tell the owner. 39 to 40 is what they should be aiming at giving. So they can definitely start. So They can start to fill it in the syringe by 40 to 41, but they will be giving it at 39 to 40 degrees Celsius. What happens if you give cold formula like 34, 30 degrees and all? It will result in crop stasis. And if it's a hot formula, which is 44, 45, 46 and all, it will result in crop burn, which you have to be extremely careful. Hmm? These are cases of crop burn. We see even after, like, we do lots of videos on Instagram, we make a lot of awareness video, but still we get patients like this, which has crop burning. Okay. And then how much should we give? Like, there are people who incubate, when a macaw lays an egg, they take the egg and they put it in the incubator. There are people who incubate the egg, and when babies come they start feeding. So this is the feeding diet that you can follow. Hmm? Like, once you have the recording, you can write it down, and if somebody asks you, like, doctor, my bird is 25 days old, how many times should I feed the bird? So it's like 4 times a day. If it's like 30 to 40 days, feed 2 times a day. So like that. So yeah. Then there are few clients who will be like, oh doctor, this is not an expensive parrot, I don't want to spend for such hand feeding formulas which is expensive. You can guide them to make a homemade hand feeding formula, which is like, yeah, it's okay. If they have the time and patience to make this, let them. You can just suggest them, mix boiled corn, soaked almonds, ground sunflower seeds, millets, sprouted pulses, brown rice, and add little vitamins, minerals, and calcium, and uh, uh, and then they can feed it. So that is a homemade hand feeding formula, but see how much it will help. So yeah. And how do we feed? So when it comes to baby birds, you can definitely feed them in syringes. I'll show you a video. See, you can feed them like this. So yes, you can always feed the bird with a syringe. It's a small baby bird. You can definitely guide them to feed with a syringe. But then sometimes people feed them with a spoon like this. You get specialized spoons like this, which is turned. So with that also you can feed the bird. And then there are equipments to feed, like a crop needle. See, you can feed the bird like this. This is my bird only. You can always ask them. So feeding the bird like this is very good because we don't have tension of we putting a crop needle and sometimes it might go into the trachea. We don't have to be scared like this. Like this you can feed. And then, as I said, we have spoons like this which you can use to 10 birds to be fed one time. People will not spend time giving the food in a syringe. They will simply insert the crop needle inside the crop and just press like 20 ml or 40 ml at a time. And when you use tubes like this, this red tube, make sure that you don't use it in birds like macaws because they can definitely bite it off. And half of the tube will be in the crop. Only 2 days ago, I removed a tube from the bird. So to avoid such things, avoid such tubes in birds like macaws and all. Okay. So this is you will get crop needles like this. You can definitely keep it in your clinic and start practicing. And also, you see, even if you are not a bird person, like you don't have a pet bird, or because you are a vet, you should definitely be aware about how to crop feed a bird, because whenever a bird comes to you, most of the time the bird will be anorectic. So it is very important to um, crop feed the bird to give the medicines and the food. So you understand how to crop feed the bird. Okay. So this is the trachea. So you will insert without involving the trachea. Okay. The small birds, you can give it like this. Insert it deep inside and then give the food. These are also mine. So that is with the general nutrition. Now let's see specialized nutrition. Okay. So when it comes to birds, like this is the Amazon parrot. The first thing is you will have to understand each species of birds. You should have a basic knowledge about what is the. It's like identifying the dog breeds. Like now we know what a Rottweiler is, golden retriever, lab. We are able to identify. No, same like that. We should be able to identify each species of birds because diet of each species of bird is different. So this is an Amazon parrot. Huh? So when an Amazon parrot comes to you, if the owner tells you that, oh, my bird eats only seed, high chances that you check the X-ray of the bird, you check the liver values, there will be fatty liver disease. The liver values will be high. This Amazon parrot will require a more of carbohydrate and protein-rich diet. They will need fruits, vegetables, stalks, pulses. Foods rich in vitamin A should be more in their diet rather than giving seeds. Seeds can be very less, like 10 pieces of seeds only to be sprinkled on top of the food. Not much more than that. And also avoid giving peanuts. Okay, somebody tell me why we are not giving peanuts to birds. Not the peanut butter, that peanut in the shell, no, which we crack open and eat. That one. Why do we avoid it?
There are chances of
Hello?
aflatoxinosis. There are chances of
Yes,
aflatoxinosis.
yes, that is true. So there are chances of getting like aspergillosis. Okay, so this aspergillosis will end up releasing aflatoxin. So which is very, once aflatoxicosis affects the body, it is very difficult to cure the bird. And when it comes to Amazons, they love to eat sweet potato. Okay, if you are, see, I'm saying this because I have a pair of Amazon parrot. They love to eat sweet potato. They love pumpkin. They love boiled carrots and red, like bell peppers. So yes, you can definitely give that. Then budgies again very commonly we see in the clinic. So whenever budgie comes to a clinic, yes, of course we know that they love to eat millets like this, right? We are like, oh, they just eat millets. But then one thing is you can tell them, you can give them this green foods like spinach or broccoli. They can eat carrot. So what we do is we soak the wheat. No, we soak it. Uh, any pulses for that reason, we soak it and we dry it nicely. Dry it means we remove the water content. And we put it in the mixie and we just crush it. We don't make it in the paste, but we crush it and then we give it to the birds. So that is easy for the birds to eat. Like that, any vegetables can also be given: carrot, beetroot, pumpkin, and all. You crush it in the mixie and give it to the bird, so that smaller birds like budgies can eat. Rather than giving just millets to these birds, adding such vegetables will improve their health a lot. And also they need good quality iodine nibbles. Otherwise, they will end up having thyroid problems. So, iodine nibbles should be provided to budgies. Then this is a common. I'm not sure how many of you see this bird. This is a kayak. They also need a lot of fruits and pellets in their diet. They can eat a lot of fruits like apples, sweet grapes, pomegranate, guavas, and mangoes. They love to eat walnut. So yes, you can give it. So cockatiels, they love to eat a lot of millets like this. We have earlier I showed you pictures of seed mixes. So for cockatiels, we have seed mixes available. So yes, definitely you can give that. Then kale you can give, spinach you can give. For them also, for cockatiels also, as I said before, rather than giving just millets, you can definitely grind or crush fruits and pulses and give it to them. And also you can add egg food to the diet. Like how do we make egg food? It should be made fresh each day. You can take bread, then you can take boiled egg, crush it and powder it and give it to them. You can add some vitamins and minerals. So egg foods can be given. Yes, it's written cuttlefish bone and mineral blocks should be given, but I don't like cuttlefish bones because if you have seen the cuttlefish bone, which is given to the birds all the time, they have small pores inside them. So whenever some water falls on them or some environmental factors, there can be a high chance of fungus growing on these cuttlefish bones. So always avoid that as a source of calcium. Instead, you can give we get lot of calcium powders and syrup, so you can give that instead. Then There is a practice in veterinary avian medicine that whenever a bird comes to your clinic with whatever disease it is, there are people who tend to add vitamin A to the diet or to the prescription. But then remember that whenever a cockatiel comes to you, better avoid prescribing vitamin A because they always end up having vitamin A toxicity because studies when the studies were conducted, uh, like these birds were given, these cockatiels especially were given only seeds. Okay, so earlier we said that seeds doesn't have any vitamins. When we give seeds only diet, there are high chances that the bird will end up having deficiencies of vitamin A. But then cockatiels, when studies were conducted on cockatiel, even though the diet was not very good in vitamin A, they didn't have any deficiencies. They had the optimum level. So imagine so keep in mind that if you are providing excess of vitamin A, it can result in toxicity in these birds. Okay. So cocktails are therefore susceptible to overdose. So supplementation should be like avoid the supplementation only, I will say. Then cockatoos. This is a sulfur crusted cockatoo. They require a high protein diet. Sulfur crust. So there are different kinds of cockatoo. So this is sulfur crusted cockatoo. This pink color is a gala cockatoo. Okay. This is again a this is an umbrella cockatoo, white one. This is a uh, what Moluccan cockatoo. I have all these cockatoo. I have all these four cockatoo. I have a Moluccan cockatoo. I have umbrella cockatoo. I have sulfur crusted, and I have a gala. So for all these cockatoos, what you have to do is you have to give a very low seed diet. They need a high protein diet. You can give them cooked seeds, sprouts, fresh fruits and vegetables. Very less of seed diet because high chances these birds will end up having fatty liver, fat, lipomas. So most of the birds with lipomas that has come to the clinic were gala cockatoo. Okay. So better avoid such high fat diet in these cockatoos, these four type of cockatoos. But then there are another cockatoo like RTBC, red tail black cockatoo, then palm cockatoo. So these cockatoos will need high fat in their diet. They love to eat walnut, they love to eat almonds, pine nuts, they love to eat sunflower seed. Love to eat matlab means they will need high fat in their diet. So that is their diet in the wild. So we will have to definitely give them such high fat diet. So whenever if a owner comes to you and they tell you, doctor, I have a cockatoo, can you prescribe the diet of the bird? Ask them which cockatoo. If it's a gala and all, don't prescribe high fat diet. But then if it's a farm cockatoo, RTBC and all, they can definitely take this thing, high fat. And also see, you can, as I discussed before, birds will require fruit, vegetables. You can give spinach, broccoli, pumpkin and all. But when it comes to birds like this one, palm cockatoo and RTBC, they end up eating only very few fruits. Like if you are giving a bowl of fruits, they will definitely choose pomegranate and orange. Rest all they will skip. So that is basically what they do. This I'm telling. So this is it is written. This is all from experience. Okay. So don't worry if your bird is not eating all these carrot, beetroot, and all as the doctor prescribed. But then these birds will definitely, and as I told you before, Amazons love to eat sweet potato, pumpkin, and all. Like these birds love to eat all these pomegranate and oranges only. They don't usually eat all this green food. So yeah. Then gala cockatoo, as I said, they require no sunflower seed because an excess, not even excess, even a little amount of high fat or oil containing food, they can result in obesity. I have done a lot of surgeries in galas which had this lipomas. Mostly in cockatoos only we do such surgeries, excess fat accumulation in the body. Even when you give them more of sweet corn, which has more carbohydrate, they can end up having fat accumulation in the body. So for them, always try to give bigger aviary so that they can fly and burn this fat off. give them a more balanced vegetable protein diet rather than adding seeds and all these carbohydrates in the diet. Then conures again, they are mixed. They can have a mix of seeds and fruits and vegetables and all. Nothing specific. They will eat anything and everything, so not an issue. Then they can take nectar, and they can take fresh green leafy vegetables. So whenever a conur comes to you, you have to be like, you should tell them, yeah, they can eat mostly anything. You can give them all, so whatever we studied, like, give 10% seeds, 10% nuts, 5% fruits, 15% vegetables, and all that here will work with conurs. They are okay. They are easy to keep, and no issue. No specific specialized diets are required. Then eclectus parrot. This is a male. Green is a male and red is a female. They need more vegetables in their diet. They also end up having excess body weight. Especially female eclectus, they can become overweight. We have to be very careful. So earlier, if you remember, if you were not sleeping, I said cockatiel birds, when birds come to you, avoid prescribing vitamin A to them. But then if it's an eclectus parrot that come to you, they require a lot of vitamin A in their diet. So that deficiency can definitely result in a lot of health problems. So you try to add vitamin A to birds like eclectus parrot. Okay. Then grey parrot. Again, grey parrot also, they require vitamins, and all this. Normal diet is okay, like seeds, fruits, vegetables, and are okay. But then for them, it is very important that we supplement calcium and vitamin A. Very important that we have to add it extra. Otherwise, what will happen? So this is vitamin, nothing but salivary gland hyperplasia due to vitamin A deficiency. This I have not seen in any other birds other than African grey parrot. So it's very important that we supplement vitamin A. And also we get lot of cases where we get lot of cases where honors call us and they'll say, doctor, my grey parrot was all healthy, but today morning it had shivering and it fell off the perch and it died. It is nothing but birds having convulsions due to calcium deficiency. Okay. Then again, lot of grey parrots end up having egg binding cases because calcium is not provided to them. So for grey parrots, along with the normal diet, you should definitely add vitamin A and calcium. Very important. Okay. Rest of all this, like they can eat all the normal mango, sweet orange, beetroot, corn on cob, sweet corn, sweet potato, etc. Normal with other birds. Then macaw, yes, macaw require a high fat diet. As I told you before, if you have a pair of macaw, giving them nuts is not a luxury. It is just the basic thing that the bird will require. Okay, so if it is a bigger macaw like a hyacinth macaw, they need lot of nuts in their diet. Lot of nuts, lot of walnut, lot of Brazil nut, macadamia nuts, hazelnut, pine nuts, walnut, everything you have to provide. Lot of big sunflower seed you have to give them. People give them this palm oil nuts, palm oil seeds you will get. People give them that. You can give them high, lot of animal proteins like chicken, egg, fish. So they should have a high fat diet. And as usual, peanuts in shell must be avoided. When the macaw is a small bird, you avoid that. Okay. Then next important thing, lorikeets. Whatever we discuss now, whatever seeds, nuts, fruits, vegetables, walnuts, these all doesn't apply to all these lorikeets. So lorikeets in general, they need special diet. Okay. They need a mix of fruits and vegetable juices. They need honey, watermelon juice, bottle brush. This is bottle brush. They love to eat bottle brush because if you see in this picture, this is a lorikeet, and you see the tip of the tongue. It is like a tuft of papillae. So because this anatomical thing, they can suck in all these juices of fruits and vegetables. So that is what they eat in the wild. That tongue of these birds are specially adapted to enable to collect the pollen and nectar from the blossom. So this is like a pactile or tiny brush. So that is why when we give food to these birds, we have to give it in a liquid form. Okay, so there are a lot of commercially available lorry food that is available, like Nutribird, Versilaga, Vitacus has a lot of brands has this lorry food. You find one and start feeding it. So there is it is not like all these food are perfectly good for these birds. So according to my knowledge, so there is a brand known as Necton. Okay, Necton has food which can be used for all species. Like, see, for example, birds like Stella lorry or all these tiny lorikeets require thin formula, thin nectar mix. So only Necton produces a different nectar mix for such birds. So, but in general, brands have lorry mix, which they say can be given to all the birds. So it comes in powder form. You'll have to mix it in water and give it to the birds. Okay. So the thing is, in general, it is very difficult to understand if a food is that lorry food is good for the bird or not. So there are few signs that you can understand. You are giving it for a long time and the bird is not trying to nest. The plumage is not good. Then definitely you will have to change the formula. Okay. The thing is, the formula should not be too thick. Sometimes if it is thick, it will not be digested properly, and if it is too thin, the problem is bird will end up having malnutrition. So the formula should be like this. Okay, so it's not like you have a specific, they will not, it is not like, okay, you take 2 scoops and you mix it in 100 ml water. It's not like that. For each bird you will have to practice and you will have to give it. It takes a little practice to understand what is good for your bird. Maybe adding 2 scoops in water and giving it to the bird will not be able to nourish the bird. So maybe you will have to add 3 scoops. Maybe maybe that 2 scoop is too much for the bird, and bird might end up having liver issues or some issues with the digestion. So you have to understand what works for your bird. And also sometimes we add bee pollen. Whenever it's a breeding season, we add bee pollen, we add honey to this bird. That is all extra things that we add along with the lorry nectar. So apart from lorry nectar, you should be feeding a lot of fruits, pomegranate. You have to add. Then sometimes I had one time, I had around 20 species of lorries in my house. So what we used to do is, one time we had like this lorry nectar. Second time, what my mother used to do is, she used to make a puree. She used to cook beetroot, nicely make juice out of beetroot. We cook oats, we add honey, we add bee pollen, we add vitamins, and this thing, beetroot juice and vegetable juice, we add it and we give it one time. So that also birds love to eat. And then next time we keep a fresh fruit. So like that 3-4 times we have to feed the lorikeet. So compared to other birds, sometimes it will be like, oh, okay, for a macaw, if it is not a breeding season, it's okay to feed them 2 times. They are okay with it. But when it comes to lorikeet, you will have to, lorries and lorikeets, you'll have to definitely feed them at least 3 to 4 times. That do freshly prepared, these juices has to be fed. Otherwise, it's better not to keep a lorry. So yeah, they can end up having a lot of issues with the liver and a lot of issues with iron storage and things like that. So if you have a lorry, you should be ready to provide them food according to their diet. And also sometimes people keep lorikeets on dry food, but then because of the high protein level, they can end up having visceral gout like this. We will know it only during postmortem. You see the bird dying all of a sudden, and then yeah, it will not be able to do much. With honey, yes, even if you are giving a lorry food, you can definitely add honey in their diet, because they love to eat. They love to have the nectar and everything from the flowers. So adding honey really helps with keeping lorries. So these are the benefits, like like they are antioxidant, yeah, all those things. Then starlings. So you must be wondering why doctor is saying starling. These are wild birds, but then people keep starlings and mynas. So you should understand what they eat. So starlings eat, this is a Bali myna. So they eat, we have insects, live worms, superworms, mealworms, superworms that we get, that you can give them. You can chop fruits and vegetables and give it to them. They will eat it. Yeah. So people keep mynas in the facility. You can end up seeing mynas as well. Yes, live insects has to be provided. See, like this, you will get animal protein, mealworms. You will get it either dried or live mealworms. You can give any of those. So then there are people who give dog food to birds like myna, but then in the long run, it is not going to help. Okay, it has high protein. It will help them with breeding, but then the bird will end up having a lot of kidney issues after a long time. So better avoid giving dog food. Then hornbills. Hornbills, see this hornbill is eating pellets. Yeah, which is very friendly. Yeah. Hornbills, again, we have pellets for hornbills like H16. There are pellets for toucans and toracos which you can give. That can be given. They love to eat fruits and vegetables like papaya, muskmelon, watermelon, and all we give. Then we give small rats called pinkies. Frozen pinkies we get. That also they love to eat. See, in the wild, if you see this hornbills and all, they eat snakes, they eat small monkeys, they eat other baby birds. So, in order to meet their calcium and protein requirement, we should definitely feed them with animal proteins like pinkies and all. So, as I said before, feeding 2 times a day is okay if it's a non-breeding season. But then when it comes to breeding season, so in captivity, when the bird breeds, it's like when they have excess of food. So always try to feed them 3 to 4 times during the breeding season, so that whenever they have a feeling that there is excess of food, they will end up breeding. So if somebody is asking you, doctor, can you write a diet for me, for my birds, you can definitely give it like this. Like morning, you can ask them to give fruits and vegetables, afternoon sprouts, evening little seeds like 10 percentage, and thrice a week you can give boiled eggs, chickens. Calcium and vitamins can be given daily. And only thing is, you should guide them when they keep fruits and vegetables and sprouts. Don't keep it more than 1 to 2 hours, or maximum 3 hours only should be kept. Otherwise, what will happen? It can become spoiled, and if the bird eats that, that can end up having some infection. Okay. So that is with the diet. Second thing is, one important thing is, you tell all these, you give them a big class about, okay, you give fruits and vegetables, you give seeds, you give nuts and this all. You will say all this story, you will give them a good description, you will give them a good diet. They will end up saying, but doctor, my bird will not eat all this. What to do? My bird will like only to eat chapati, roti, what to do, this, that, and all. They will start crying. So that is the biggest challenge. So then you tell them, see, that is how you educate the owner. So you tell them, see, if your bird has to start eating good food, it is you who have to change. It's not the bird. Okay. So you tell them, so if the bird is eating seeds in the morning, just ask them to remove the seed from the cage and give fruits or vegetables. So that once the bird is hungry, the bird will slowly start eating. Then if the bird has not eaten by evening, then provide little seeds. Then stop giving all this home cooked food, chapati, roti, chai, coffee, and all. Ask them to avoid giving that. Only if the owner stop giving, the bird will stop eating. And also tell them that any change in diet will definitely take 1 to 2 months. Because the owner met a doctor and got the prescription, don't expect the bird to start eating healthy from the next day onwards. So if you want your bird to start eating healthy, it will take some time. And also anything related to nutrition, any disease that is related to nutrition will definitely take some time to show results. So that is very important. And also you can ask them to chop the food little bit, sprinkle some seeds on top of it. Like that, the bird can also start. By eating that seeds, they will eat little bit of vegetables and maybe they will like it and they will start eating. So they will have to start experimenting a lot on birds about their diet and about how to feed them. Then only they can make a difference in their diet. So that is the end of the presentations. So yes, so if you have any doubts, you can ask. I think there is a quiz section that sir has arranged.
Yeah, there is one announcement that there is again a quiz after the question and answer section. And Doc, you can access the questions by reaching out the chat box. Do you see the chat box? Just click on
Yes,
that.
1 second. Let me
So,
just stop sharing.
so there's a good news that today again we are going to have a session on this quiz session, and there must be a prize of 2,500 rupees Amazon gift vouchers for everyone, right? So there are a lot of questions in the chat box, and one doc raises one important question that by feeding chicken to the birds, will it increase the chances of being them cannibal? So these are the queries there.
1 second. Let me just. Okay, lot of questions. Let me. Let's.
You're trying to log in through mobile?
No, that is taking a lot of time.
Achha, just leave it. Just leave it. So see the questions. Let's.
No,
have a
I
look
think
on
we'll
the.
leave it as a surprise. So always will go and search on my Insta to see how I look. Then I'll get
No
Insta
problem.
followers.
No problem. No problem.
I don't know why this is not working. Yeah, it's so sad. Like, you know.
It's okay. It's a good news that we have another sessions pending. So
Yeah, we have
better
other
luck.
sessions. So
Better
next
luck
time
next
onwards
time.
will be more.
Are we going to have
No.
this next on the 29th?
Should we have it on, because that is a like should we have it on 29th, or can we have it on 5th, doctor? Is that okay?
Let me check out the calendar and we'll discuss. So please
Sure,
have a
sure.
look on the chat box.
Yeah. So feeding
scroll
chicken,
it.
no, cannibalism doesn't happen. No, it doesn't happen. See, one thing is birds eat. If you meant by cannibalism, is it like they're trying to eat the baby birds? No, if they have enough protein and enough vitamins in their body, they will not end up having eating the baby birds and thing like that. But apart from that, see, we provide chicken and egg. In general, that will not happen. Not an issue. They will have a more balanced diet. That's all. How much food can we have to give birds? See, there is nothing like, okay, for a macaw you give so much quantity. So it depends on, see, ideally we give, if it's so see, it's an adult bird. What we do is, if it's say, for example, let's start the hand feeding formula. If it's a 1 kg bird, so ideal amount of food, hand feeding formula that you have to give is 100 ml. Okay. If it's a 500-gram bird, you will have to give 50 ml. Then if it's an adult bird, amount of food that you can give at one time is around, you can give around 100 grams of food. But imagine you calculated and you gave 100 grams of food to the bird, and the bird is not, bird is finishing it off completely. It is licking the plate and completely finishing it off. That means the food that you have given is not enough for the bird. You will have to provide a little more extra to the bird. So each bird, it is different, even if there are like specific food concentrations that has been mentioned, but then you have to understand your bird, and then it is like a small kid. See, there are parents who complain my child is not eating at all, then there are parents who complain like my child is eating a lot and is putting on weight. So it's similar to that. You will have to understand each bird, and then you will have to give it. There is nothing like specifically, okay, you give this and so much only you can give, nothing like that. But then when it comes to fatty foods like sunflower seeds and all, you keep it at minimum. Only that has to be taken care. Are there any toxic foods? So that's what I told you, foods which are which shouldn't be given to birds, like avocado, even chocolate cannot be given. Avocado can result in cardiotoxicity. Then chocolate, it doesn't cause chocolate toxicity as such, but then it can result in this thing, obesity, and sugar in general, it is not good. Then alcohol is not good. Then if you're giving apple seeds, it can cause it. Apple seeds has a cyanide in it. It can definitely cause toxicity. All such things. Then if you are giving iron-rich food or vitamin C rich food to birds like pucans, toracos, lorikeet, it can result in hepatic toxicity. Like it can result in a condition known as hemosiderosis, iron storage disease. Like that, the bird can be affected. So only that has to be there. what kind of bowl to provide food and water to wild peacocks in summer? Just so I would suggest you can give food in that mud clay pots. Clay pots are really good. No, nothing like that. Yeah. So there is, if you can provide the water in clay pots, that will be really good because it has that cooling effect also. How can we differentiate between sandoma and the feather cyst? So you take a cytology, uh, you like a fine needle aspiration. You do a fine needle aspiration, see the cytology, and xanthoma is nothing but fat accumulation. So cyst will have all this liquid. So yeah, even with palpation also you will understand if it's a xanthoma or a feather cyst. Peacock nutrition. See, peacocks in the wild they eat lot of snakes and everything, but in the captivity they eat more of grains. They eat vegetables, like whatever we gave they eat. But then if specifically I have something, if I find an article, I will send it to you. How can we differentiate bird picking the feathers in boredom? See, one thing is plucking disease again is a big topic. So whenever a bird comes to you with feather plucking, taking a history is very important. You have to start with the diet of the bird, age of the bird, how long the bird has been plucking, and understand if it's an infection. You simply take the feather of the bird and you see it under the microscope. If there is a mite infection, you can definitely see mites running through the feathers. Then treat it accordingly. Then again, if you still doubt, see feather plucking can be due to many infectious and non-infectious. Infectious causes, one thing is mite infection, this lice infection, which definitely you take a feather and you see it under the microscope, you can identify. Then there are viral diseases which cause feather plucking, like Borna viral, not Borna, polyoma viral infection, circoviral infection like citizen beak and feather disease. For that, you will have to pluck the feathers and send it for DNA analysis. So that has to be done. Then again, if you find that the skin is having some issues and that is why the feather plucking is happening, you will have to do a cytology and a culture. If all these comes negative, then you will have to understand what is the diet of the bird. Then there can be behavioral feather plucking, either because of anxiety, because of boredom, because it's an habit. Yeah, it can. So feather is again a big topic. Like we can talk a lot about it. If we have sessions with that, we can talk one day about even dermatology. So yeah, first you have to identify if it is just pluck the feather and see if it's some infection or not. As simple as that. Most common disease related to poor nutrition. Again, vitamin A deficiency can happen. Like I said, salivary gland adenoma can happen. Then liver problems. So fatty liver problems, lipomas can happen if there is excess of fat in the food. Then hepatic damage can happen if poor nutrition has ended up in causing problem to the liver. You can see lot of the green, usually if it is a green parrot, the parrot will end up looking like black in color because discoloration of feathers can happen, overgrown nails and beaks can happen. Yeah, lot of things these are the few things that you will commonly see. Dewormer for birds. See such medicinal questions. First thing you have to, what I you always tell people is you should have a textbook which is known as exotic animal formulary. Deworming, see, if somebody asks you which is the best dewormer for dogs, what do you say? You will say, yeah, there is praziquantel pyrandal combination, there is fenbendazole, there is ivermectin, there is this, that, and levamisole, lot of things, no? So same as that for birds also, there are different medicines available. Like you can use fenbendazole, you can use ivermectin, there's a combination of oxfendazole, praziquantel, there's a combination of praziquantel, moxidectin. Yeah, you can use, there are a lot of things available, so you can use any of this. Only thing is you will have to keep changing every time, because there is a brand which has a picture of the bird and which is a brand which sells bird medicines of the bird, doesn't mean that you have to keep using it all the time. You have to so there is a medicine known as worm out gel, which is by Beta Farm. So we have been using it from uh, like so many years. When I have birds from my childhood, we have been using it for so long, but now that medicine is very resistant to all these birds. So yeah, so no point. So you have to change the medicine. Improve the immunity in birds. Yeah, just give proper diet, proper environment. yeah, if you follow all this, if you provide all this good nutrition, of course the immunity will be improved. Thank you. Necessary to give bath to the bird. So there are birds like lorikeets. Like if you provide a ball of water, they will take bath in that. Then if your bird is used to bathing, like you can spray them with water, yeah, then definitely you can provide, you can spray them. But then I have seen videos where people take the bird to a grooming center, bathe them with soap and water, shampoo, and then blow dry and all. That is extremely stressful to the bird. Never do that. But then keep a ball of water and let them learn themselves to learn bathe. Or you can, if it's a very friendly bird, you take them under the tap and they will bath themselves. You don't do it, let them do it. So what you can do is just spray them, they will do the rest. I think, yeah, recordings will be available. PPT I don't share, but recordings will be available. Okay. Malnutrition, lot of things can be seen. One thing is weight loss, you know, feathered. See, what is this, like proper featheration will not be there. The nails and beaks will not be in good shape. Yeah, a lot of things. Malnutrition, yeah. Stress also, yeah. Signs of stress means the bird will not eat. They'll be panting. If you meant that stress, there'll be, as I said, there'll be sometimes stress lines will be there on the feathers. So yes. No, peanut butter, see, it's not like you like we eat. So for us also, when we go to the gym, people say take peanut butter. Imagine you sit and eat the whole tub of peanut butter. It is not good for us. No, as I said, peanut butter, if it's a bigger bird in 250 ml of food, huh, you add 1 tablespoon. And again, I told you, if it's a 1 kg bird, if it's a macaw, we feed only 100 ml at a time. So don't feed excess. Excess, yes, of course, you will have hepatic lipidosis. How to manage dehydrated bird? You will have to give saline, like fluids. Fluids. There are different ways of giving fluids, like intraosseous, intravenous. But the best thing is, if you are not much experienced in all this, giving subcut fluid is the best way. Subcut fluid in between the legs, in between the thigh region, inguinal region, you can give subcut fluid. That is the best thing to do. We will learn lot of things like intraosseous, intravenous and all, but that can all, it's not giving proper result. It can be stressful to the bird. You can give selamectin, but ivermectin is also good for birds. Should sprouts and vegetables be blanched in warm water for one? See, that again depends on the bird. Some birds will love to eat raw vegetables. Some birds will like it part boiled. Some birds will like it fully cooked. Some birds will like it chopped. Some birds will like it make it into a paste. There is nothing harm in giving all that. Only thing is you will have to understand your bird and then give it accordingly. Tail bobbing. So you guys are asking, hello, you ask questions about anatomy and nutrition. You guys are asking me questions all over the bird. So tail bobbing is a sign that the bird is having a issue. And tail bobbing is not a, so it can be like when you see the observe the bird from a distance, the tail will be moving up and down. Okay, so tail bobbing is when usually a lower respiratory tract problem. Maybe there is a aspergillosis in the lower air sacs. Then sometimes if it's an egg that is stuck in the body, then there is some organ that is big, that is a hepatomegaly. Then tail bobbing can happen. Then where there is ascites, tail bobbing can happen. So yes, tail bobbing. So one thing from whatever I told, understand that any respiratory condition, tail bobbing is a respiratory condition, any respiratory condition, any tail bobbing sign is not something that is related to the respiratory system. That you have to understand. Imagine a bird comes with tail bobbing. Don't go and give antibiotic to the bird. Don't go and nebulize the bird. Sometimes it can be an egg that is stuck in the abdomen. So understand this thing and then start the treatment. Apart from sandy perch, what can be used to maintain nails? Trim the nails. That's all. Why iron storage disease? Because they are prone to, you know, their system is prone to take up all the, their liver is prone to take up all the iron in the body. It can be concentrated in the liver. So that is why, unlike other birds, they have issue with iron storage. How does gut health related to? Yeah, it is same. Like if the gut health, if it is same to us, no. If gut health is poor for us, it will definitely affect our immune function. Similar to that, birds also gut health will be affected because our gut is the second brain. So there are problems with neurotransmitters happen, and it definitely will have issues with the immune function. How much food? Uh, See, if, that is what I was telling you in the beginning. So there is no specific amount, but if it's a hand feeding bird, 10 percentage you can give. Yeah. You will have to send the feathers for PBFD testing. I already explained about dewormer. Vomiting again can be because of many reasons. Bird can vomit. First thing is if there is a bacterial infection, fungal infection, if there is some foreign body stuck inside the tummy or the crop. Yeah, these are the common things that, or if there is a metal, whenever there is toys or painted cages, if there is a metal inside the body, the bird can start vomiting. Apart from that, if a macaw vomits, apart from all these things, you will have to think about a disease known as Borna viral infection, which I was telling, where the ventriculus will be enlarged and vomiting is a very common sign. Sparrow. Sparrow, you can feed little hand. So what we do is we feed hand feeding formula, and if you have mealworms, you can feed that. Mealworms are good. Okay, lot of questions. Next time onwards, hello, ask questions from what I take class. Otherwise, you can keep on asking me a lot of questions. So yes, I think we'll start the quiz, and whoever answers first will get.
Yes, Doc.
Prizes.
Let me share the screen. So first of all, I would like to tell rules of the quiz. One question will be displayed on the screen with the answer. Will be displayed on the screen, and you will be given time for, I think, 30 seconds will be enough to give the right answer, I believe. And Kanika will be taking care of the timer part. And she will, when there will be a time will be over, she will write some message that it's over now. And then Dr. Rani Maria will decide what is the correct answer, or will display the answer on the screen. And whosoever has given the first correct answer is the winner of the question, first of all. And one participant can submit only one answer. One participant winner selection, the participant whose correct answer appears first in the chat box will be declared as the winner. In case of any dispute, the speaker's decision will be the final and binding. Please stay in a good network zone to avoid delay in chat posting or disconnection. Reminder, it's a healthy competition. Let's keep it fun, fair, and friendly. So I'm showing the first question on the screen. Yes, question 1.
It's already started.
Please don't speak, just write in the chat box, please. Any oral answers will not be entertained. Just write the answer in the chat box only. So time is over. I am displaying the answer. Dr. Rani Maria, are you seeing the chat box?
Yes, sir.
Please check who has given the answer first, correct answer first.
So actually, Dr. Amit Verma has typed uropygium gland, and Satish has typed uropygeal gland. So I don't know.
Your answer has to be your answer.
Yeah, uropygeal is the correct answer. So I think Dr. Satish has given the right answer.
Dr. Satish is the winner of this question. I hope, Dr. Satish, you know a company mail ID and WhatsApp groups. Even Kanika is sharing her number directly on the chat box. So who are the winners has to contact us as soon as possible. Please write your name. If you are a practitioner, then practice name. If you are a student, that's no matter your college or university name, which year you are studying, and which question you have won. So these things you have to write down so that easy communication can be done. So now I'm displaying second question. And second question is this. Dr. Rani Maria, you can speak out the question. I mean, if you want to read out the question, you can read out the question.
Species of birds which lack crop. A lot of people have messaged.
It's quite interesting. You should see. See, I know most of the clinics start at 5 o'clock. Still at 5:30, 150, more than 150 participants are there.
Okay, so the time has stopped already.
Time is over.
So a lot of
And
people have mentioned owl, penguin, and all. It's correct, but then the M. Jivita has mentioned owl. So yeah, owl is the correct answer.
Jivita.
And I
M.
think
Jivita.
winner is Jivita, M. Jivita.
which one can you?
M. Jivita.
Dr. M. Jivita, you are the winner of this question. Congratulations. So it's time for the next question.
Food that causes cardiotoxicity in birds.
That I also remember. You have
I
mentioned
think all of you
this.
are like all of you are listening, not sleeping.
People are very active. By just seeing their
Yeah,
questions
good,
on the
good,
chat
good,
box, you
good.
can understand people are
Yes,
very
yes.
much interested in this topic.
Really exciting.
Quite exciting.
Time stops now.
Yeah, I think the winner is Dr. Where is he? Dr. S. Kamal Raj. Avocado is the answer. So vitamin A
Doctor?
doesn't cause. Yeah. So can I just say vitamin A doesn't cause cardiotoxicity. Peanut doesn't cause cardiotoxicity. Peanut it can cause aflatoxicosis. Okay, because aspergillosis can be there. Apple, what I said is it has apple seeds will have cyanide in that. So like that it can cause central nervous system toxicity. But then especially cardiotoxicity, avocado can result in. Okay.
Okay. And I'm displaying the next question.
Temperature at which hand feeding formula should be fed to baby birds.
Time stops now.
So because we discussed, so a lot of you, I would say like 39 to 40 is the correct answer. Dr. Shruti. So people have told 39 and all, but then because we were like specifically saying 39 to 40, I would say 39 to 40. Dr. Shruti has given the correct answer.
Dr. Shruti is the winner of this question. Dr. Shruti, congratulations.
Now we're on to the last
Somebody is
question.
messaging Abdul Abubakar is saying 45 degrees Celsius. You shouldn't give it 45 degrees Celsius because the bird will have crop burn. You want to kill the bird, what doctor? So
Okay.
don't give to 45. Give it a 39 to
Yes.
40.
Yes. Now, the last question.
Cockatiels are prone to toxicity of which vitamin?
Really good questions. So time is over for this question. And
So we have a winner.
Answer.
The winner is Ankit, Dr. Ankit R. Bara. Vitamin A is the answer.
so wonderful session, Doc. The only thing is we couldn't see you throughout the session.
Yeah,
Yes,
next
yes,
time
yes,
we will
yes,
manage.
yes. Video is there. So please, we want to see you if you
Yeah,
can.
sure, sure. Yes,
Yeah.
thank you all for listening because
Doc,
according to
you
me,
were there.
nutrition and this thing, anatomy is a very boring topics for me. But then thank you all for listening. So we will have more interesting topics in the upcoming classes. Yeah.
Yeah, and Dr. Rani Maria, on behalf of team of Orihill Life Sciences and all participating veterinarians, I would like to extend my sincere gratitude to you for conducting such a wonderful first webinar of our avian medicine series on avian anatomy and nutrition. Your simple, practical, and experience-based technique and teaching style made the session extremely informative and easy to understand for practicing veterinarians. The knowledge and clinical insights shared by you have surely encouraged many vets to explore avian and exotic animal practice with greater confidence. We truly appreciate the time, effort, and dedication you have given to this educational initiative. This was a fantastic beginning to the series, and we are excited looking forward to the upcoming sessions and learning more under your guidance. Thank you once again, ma'am, for your valuable contribution. Have a joyful evening.
Thank you so much. Thank you, sir, for giving me this opportunity, and thank you everyone for genuinely, uh, waiting to for the whole session. And thank you so much for joining. And see you all soon in the upcoming sessions.
Take
Yeah.
care. Bye bye.
Good evening. Take care. Bye bye. Yeah.
pharmaceutical company for Companion Animals of the Year goes to Ori Heal Life Sciences Private Limited, Dr. Vishal Sharma from Ori Heal Life Sciences Private Limited.